Okay, so these are your side-lying hip CARs or controlled articular rotations. You're going to set up in a side-lying position. You can use a yoga block or a pillow to support the head. And then with the knees, we want to be with a 90-degree angle with the knees together. Okay, so to initiate the movement, Autumn's going to start by trying to slide her right knee slightly over the left knee. And then from here, she's going to create abduction by separating the knees. And as she lifts up, she's trying to constantly keep that right knee aligned with the left knee for as long as possible, creating true abduction. From here, Autumn's going to internally rotate, so she's trying to keep the knee in the same position and pull the foot back to find that internal rotation. From here, she's going to extend the hip back, continually trying to further internally rotate, so further bring the foot outside of the knee, so you can keep going back, 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 and then she's going to drop down towards the floor, keeping the hip extended all the way down, and then we're going to come back, bringing the knees back into alignment. Okay, let's do one more in that direction. So the first step, bringing the knee over the left knee, abducting, separating the knees, lifting up as high as possible. Good, and then from here, finding that internal rotation, so keeping the knee in the same pace, driving the foot back, continuing to do so as she extends the hip, and then dropping that knee down to the floor, keeping the hip extended for as long as possible, and then rejoining with the other knee. Good. Once you've done a few in one direction, we're going to go in the other direction. So Autumn's going to lift the knee off from the other knee, and then she's going to extend the hip back to start. So she's trying to reach that knee back as far as possible. And then as she lifts the knee up towards the chest, she's now going to be externally rotating with the hip. So that foot's going to start to come back round, finding that base position. And then from here, the knees are going to come together. Again, keeping control throughout. Let's do one more in that direction. Good, now while she's doing this, I'll talk about common compensation. So typically when people do this, they start to twist with their torso. So what you can do to avoid this is place an object behind you and try not to touch that object as you go through the movement, okay? And that's going to really provide you with a checkpoint that you're just isolating the movement to the hip joint. So those are your side-lying hip CARs.